Welcome to BoxedIn Health. Today we uncover the topic of myopia. Nearsightedness, also known as myopia, is a common vision issue where nearby objects appear sharp, but those farther away seem fuzzy. This happens because the shape of the eye, or specific parts of it, causes light to refract incorrectly. Instead of focusing on the nerve tissues at the back of the eye, the retina, the light converges in front of the retina. Typically, myopia develops during childhood and adolescence, stabilizing more between ages 20 and 40. It often runs in families. Nearsightedness is a refractive error. This happens when the cornea's shape or condition, or even the eye's overall shape, leads to an inaccurate focus for incoming light. Nearsightedness typically arises when the eye is too long or oval-shaped rather than round. It can also be caused by the cornea having a steep curve. These changes result in light converging in front of the retina and crossing, causing messages from the retina to the brain to appear blurry. A basic eye examination can confirm nearsightedness, and you can correct the blurred vision with eyeglasses, contact lenses, or refractive surgery. Symptoms of nearsightedness can manifest in several ways, such as blurred vision when trying to focus on objects at a distance, the need to squint or partially close your eyelids to see things more clearly, occasional headaches, eye strain, especially when attempting to view distant objects. In children, you might observe signs of nearsightedness through their behaviors, including persistent squinting, appearing unaware of objects at a distance, frequent blinking, frequent eye rubbing, preferring to sit very close to the television. For adults with myopia, challenges can arise when reading street signs or store signage. Additionally, some individuals may experience blurred vision in low light conditions, like during nighttime driving. This particular condition is referred to as night myopia. Regular eye exams are essential for maintaining good eye health, as both children and adults may not always notice gradual changes in their vision. The American Academy of Ophthalmology emphasizes the importance of routine vision screenings to ensure early detection and proper treatment. For children and adolescents, these screenings are typically conducted by pediatricians or healthcare providers. They perform straightforward eye exams shortly after birth, between 6 and 12 months of age, and again between 12 and 36 months. If any concerns arise, they might refer you to an eye specialist, an ophthalmologist. These vision screenings can also take place at schools or community centers, with recommended intervals including at least one screening between ages 3 and 5, another before starting kindergarten, typically around age 5 or 6, and then yearly screenings through high school. If any issues are identified during a screening, it's important to schedule a comprehensive eye exam with an optometrist or ophthalmologist. For adults, the American Academy of Ophthalmology suggests a schedule for healthy individuals with no known vision problems or eye diseases. At least one complete eye exam between ages 20 and 29. At least 2 complete eye exams between ages 30 and 39. A complete eye exam every 2 to 4 years from ages 40 to 54. A complete eye exam every 1 to 3 years from ages 55 to 64. A complete eye exam every 1 to 2 years after reaching age 65. However, if you have specific risk factors like diabetes, a family history of eye disease, high blood pressure, or other heart and vascular disease risks, you may require more frequent eye exams. The same goes if you wear prescription glasses or contacts, or if you've undergone vision correction surgery. Your healthcare provider or eye care specialist will determine the appropriate exam schedule for your unique circumstances. In your eye, there are 2 important parts responsible for bringing images into focus. The cornea, which is the clear, curved front surface of your eye. The lens, a clear structure that's roughly the size and shape of an M&M's candy. To see clearly, light needs to pass through both the cornea and the lens. These 2 components work together to bend or refract the light, ensuring it converges precisely onto the nerve tissues located at the back of your eye, known as the retina. These retinal tissues play a crucial role in transforming light into signals that are then transmitted to your brain, allowing you to perceive and make sense of the images you see. The diagnosis of nearsightedness involves a standard eye examination. Your eye care professional will likely begin by inquiring about your medical history and any medications you may be taking. Visual acuity test. To assess your visual clarity at a distance, a visual acuity test is performed. You will cover one eye, and the eye care specialist will ask you to read from an eye chart featuring letters or symbols of various sizes. This process is then repeated for the other eye, and specialized charts are available for very young children. Phoropter test. During this test, you'll read an eye chart while looking through a device equipped with different lenses. This helps determine the most suitable prescription to correct your vision problems. Other eye health tests. Your eye care specialist will also conduct straightforward tests to evaluate how your pupils respond to light, your eye movement, your peripheral vision, side vision, the pressure within your eye, the condition of the cornea, pupil, lens, and eyelids. Inner eye examination. To assess the condition of the retina and optic nerve, your eye care specialist will employ a special lens with a light dilating eye drops may be used to provide a clearer view of the inner eye, though this can make your eyes sensitive to light for a few hours. You'll be provided with temporary sunglasses by the specialist or can use your own to alleviate any discomfort. Several factors can raise the chances of developing nearsightedness, including genetics. Nearsightedness often runs in families. If one of your parents is nearsighted, your risk of developing it is higher. The risk increases even more if both of your parents are nearsighted. Prolonged close-up activities. Spending a lot of time on activities like reading or other up-close tasks is linked to a greater risk of nearsightedness. Screen time. Research indicates that children who use computers or smart devices for extended periods face an increased risk of developing nearsightedness. Environmental conditions. Some studies suggest that not spending enough time outdoors may also heighten the risk of nearsightedness. Nearsightedness can lead to a range of complications, from mild to severe, including educational challenges. Children with myopia or other vision issues might encounter difficulties in their schooling. This can manifest as delays in reading and other academic skills, struggles with social interactions, and a decrease in self-esteem. Diminished quality of life. When nearsightedness remains uncorrected, it can hinder your ability to carry out everyday tasks effectively and enjoy various activities. Eye strain. Uncorrected nearsightedness can result in persistent eye strain and headaches due to the extra effort required to focus on objects. Safety concerns. An uncorrected vision problem can jeopardize both your safety and that of others, particularly when you're driving a vehicle or operating heavy machinery. Risk of other eye issues. Severe nearsightedness increases the likelihood of developing serious eye conditions such as retinal detachment, glaucoma, cataracts, and other eye-related problems. The primary aim of treating nearsightedness is to enhance vision by helping light focus on your retina, which can be achieved through corrective lenses or refractive surgery. Managing nearsightedness also involves keeping an eye out for potential complications such as glaucoma, cataracts, and retinal detachment. Prescription lenses. Corrective lenses are a common approach to addressing nearsightedness. They work by counteracting the increased curvature of the cornea or the elongation of the eye. There are two main types of prescription lenses. Eyeglasses. These are a straightforward and safe way to sharpen vision for those with nearsightedness. Eyeglass lenses can also be tailored to address a combination of refractive issues, including nearsightedness, astigmatism, and presbyopia. Contact lenses. These small, plastic discs are placed directly on the cornea. A single contact lens may correct multiple refractive errors. Different materials and care requirements are available, and your eye care specialist can recommend the most suitable type for your prescription and lifestyle. Refractive surgery. Refractive surgery aims to reduce the reliance on eyeglasses and contact lenses. It involves using a laser to reshape the cornea, resulting in a reduced need for nearsighted prescription lenses. Even after surgery, you may still need to use eyeglasses occasionally. There are several types of refractive surgery, including LASIK, laser-assisted in situ keratomyelitis. This procedure involves creating a thin flap in the cornea and then using a laser to reshape it. Recovery is generally quicker and less uncomfortable compared to other corneal surgeries. LASIK, laser-assisted subepithelial keratectomy, LASEK, involves creating an ultra-thin flap in the cornea's outer layer, epithelium, and then using a laser to reshape the cornea. PRK, photorefractive keratectomy. In PRK, the surgeon removes the entire epithelium and uses a laser to reshape the cornea. A temporary protective contact lens covers the cornea until the epithelium naturally regrows to conform to the new corneal shape. SMILE, small incision lenticule extraction. SMILE involves cutting a small disc-shaped piece of the cornea using a laser and removing it through a small corneal incision. Unlike other procedures, there is no flap or removal of the epithelium. Surgical options are not suitable for everyone with nearsightedness and are typically recommended when the condition has stabilized. Your surgeon will discuss the advantages and risks of surgical treatments with you. Treatments to slow or halt nearsightedness progression. Researchers and healthcare professionals are actively exploring more effective methods to slow the progression of nearsightedness in children and adolescents. Some promising approaches include atropine. Low doses of atropine eye drops, typically used to dilate pupils during eye exams or surgery, may help slow nearsightedness progression. Increased outdoor time. Spending more time outdoors during childhood and adolescence can reduce the risk of developing nearsightedness. Dual focus contact lenses. Some types of dual focus contact lenses have demonstrated potential in slowing the progression of nearsightedness. If you enjoyed today's video, do like, share and subscribe for more informative content. Thanks for watching.